Toilet Organization, Dr. Soumya Swaminathan, Chief Scientist, WHO, and Mark Bala, he's the author of Toilet Warrior. Naina, let me come to you first. Thank you so much for joining us and always supporting us through our campaign. You have been very passionate about the cause of water and sanitation for years now, over a decade actually. Do you think that the Swachh Bharat mission has been one of our strongest tools to fight the coronavirus? I mean, the spread of COVID would have probably been worse if we had faced it before 2014.
Ambika, you have hit the nail on the head. I mean, if you think about what the communication has been on the Swachh Bharat mission, it is not just about going to the toilet or building a toilet. It's been about hygiene, and it's about washing hands and clean habits. And we have had very large campaigns, whether from the government or from the India Sanitation Coalition, which I work with, on communicating exactly this, the hygiene that comes from washing your hands, keeping your environment clean. And by doing this, I think if we can renew that same communication and not just revel in the success that the Swachh Bharat mission brought in this regard, take us right back to doing what we must to keep our immunity up by keeping our hygiene clean.
Let me just bring in Dr. Soumya Swaminathan. Thank you very much for joining us. We've all been watching you with great admiration and the WHO. I just wanted to ask you, so much has changed in the last 6 months. A lot of learning and a lot of de-learning. So where are we at now, and what have we de-learned and what have we learned, not only for COVID but also for other infectious diseases?
I would highlight two aspects, Pranoy, and first of all I should start by saying that Mahatma Gandhi believed that health is true wealth, not pieces of gold and silver. And we've seen that very clearly now. Look at the economic damage across the world, the way that GDPs have fallen. And it's all because of one little virus that has ripped across the world. So two things. One is for us to be better prepared. This isn't going to be the last big outbreak or pandemic that we see. And in fact, in India, we've seen how rapidly we were able to ramp up things like diagnostics that are needed, how quickly the lab capacity was expanded, that people were trained, things were being made in India, ventilators and other equipments that needed to be imported in the past. So this is all about preparedness. It's about human resources, but it's also about infrastructure, capacity, surveillance, the ability to look at data and make local decisions. So all that is public health preparedness. And I think on the other side is individuals and people, how much people's behavior really can affect health outcomes. For example, we've seen that normally you would have a big influenza season in the southern hemisphere because their winter is in our summer. This year there's been hardly any flu. That's probably because people were maintaining physical distance, using hand hygiene and masking, when they go out. And so other diseases, which are also spread through droplets and which are respiratory infections like influenza, but also tuberculosis, can be controlled if people adhere to certain public health measures, including not spitting in public and not urinating and defecating in open spaces. And I know that we've made progress on these fronts, but I think a lot more can be done. So it's both public health preparedness and individual behavior change. And this is also linked to other things like physical exercise, like tobacco, diet, adequate diet and nutrition, and of course air pollution, because these are all the risks to our health, which actually account for 80% of mortality. So if you look at the 100 people who die and why they die, 80% of it is because of these underlying risk factors. And so we need to start by addressing those, because prevention is obviously much more cost effective and better than cure.
Soumya ji, this is Amitabh Bachchan. I just wanted to say that as WHO, the body that is leading this fight against COVID, when do you realistically feel or see or suppose that the vaccine is going to come out? And how is it going to be disseminated? I know I spoke earlier about this and said, vaccines are so rare. We don't have a vaccine for HIV yet, but I'm just asking this. And I do appreciate what you just said about getting yourself investigated, doing tests to find out what you're suffering from, and to have the belief that any kind of investigation can lead to some kind of a cure. And as United Nations Ambassador for Polio, this is something that we had to battle with when we were working towards getting India polio free. For 8 years we fought this battle. And one of the main obstacles was that nobody was wanting to take in these 2 drops, just these 2 drops, and to instill in them some kind of confidence. I know that the vaccine, we spoke to some of the earlier members that came onto the program, say that it may not last forever. There's no guarantee that either it can be made, or even if it is administered, will it last long? Where do you see all this going?
Thank you, Amitabh ji, for your championing of health causes, because I have met you earlier in a tuberculosis. You've been a champion for tuberculosis, for hepatitis,
yes,
of course, for polio, and also when you suffered from COVID, you were giving a lot of public messages about it. So, and I think it makes a difference, especially to the stigma that surrounds some of these diseases. And so it really helps role models and celebrities when they talk about these diseases, and that anyone can get them, but then also give the correct preventive messages as you have been doing. As far as a vaccine is concerned, I think we can be optimistic because there are so many vaccine candidates under development, different platforms. It's a huge amount that's been invested, absolutely unprecedented, the kind of pace at which this has happened. Normally, we would wait for 5 years for a trial, minimum of 5 years. Today, we're looking for a vaccine within 12 to 18 months. And I think it can happen, but we have to give it 12 to 18 months. There are now about 9 vaccines in advanced stages of trials. We probably start expecting to see the results around end of the year, beginning of 2021. And then it takes some time for the regulatory authorities to approve these vaccines, for them to be shipped into countries, for ministries to start the vaccination program. So realistically, I think we're looking at middle of next year when people will start getting it. Yeah. You asked about allocation, very important, and that's what we are trying to focus on, is fair and equitable allocation, so that we're not in a situation where if a few countries have 100% of their populations protected while the rest of the countries are just waiting and waiting. So we're hoping that as vaccines become available, that they will be fairly distributed, that the most needy, the most high risk, most vulnerable in all countries will get it at the same time. And that's the only way that we can start bringing, an end to this acute phase of the pandemic. But I think we should prepare ourselves that it's going to be another year or two before enough people in the population are vaccinated and are protected. Until then, we need to practice all of these measures that we've been talking about. It's tough, but I think we have to just grit ourselves to do it, because there is light at the end of the tunnel. We are going to get over this, but it's going to need this kind of huge public cooperation and trust and trying to help each other, to protect each other.
Yeah, thank you so much. I'm glad you talked about, my personal involvement in the tuberculosis campaign and the hepatitis B campaign. Fortunately or unfortunately, I look at it as fortunately, I was able to associate myself with these campaigns because I was able to give my own personal example. I don't expect everyone to be able to do that. It's just fortunate that I was diagnosed with TB in the year 2000 when I was just about starting my TB program. And because it was detected, because there was tests done immediately, I was able to overcome it during a course of a year. There was medication, there is a cure. Hepatitis B was another history of mine which, started with my accident in 1982, and it remained in me till almost 2006 when it was detected, and 75% of my liver is gone. But what I can say is that I'm surviving on 25% liver. And that was the example that I find many more people need to be giving. I know that Sanket and me were talking casually about him wanting to talk to me about my stay in hospital during my COVID experience. I just feel that, there's a certain kind of medical confidentiality that all patients and all hospitals observe. But really, you know, Sanket, it was the immense dedication of the doctors and the nurses. And it's just unbelievable the kind of work that they're doing. Absolutely. Every one of them. Absolutely. Staying on the premises 24 hours, not going home, meeting their children or their wives and their family. And at the drop of a button or a press of a button, they're there in front of you to help you out. It's just unbelievable. All the workers in the hospitals, all the doctors and nurses, just completely dedicated. And one of the things, I don't know whether we should talk about it, is that one of the after effects, a lot of people say, you know, you've come out of it, so what are the after effects? One, of course, is that you get weakness for about 4 or 5 months. And right now, it's very prevalent with me right now in this program. But no, but just, I'm just kidding.
You lost some weight.
No, it's not because of that. Yeah. But you know, the other thing that came across was that for a human being, it is very essential to see another human being. And that is a cause of great depression amongst post-COVID patients. Because for the period that they're in hospital, they don't see any other human. The only people they see are ghost-like white-dressed doctors and nurses. Who you don't see their face, you don't see their expression. And that is a cause that, you know, of great depression. That's a post-COVID.
Mental health is a huge problem in a post-COVID scenario. Bhumi, I believe you wanted to ask.
Yeah, sorry.
Just adding to the whole conversation of sanitization, first I would like to thank Soumya. Thank you so much, ma'am, for joining us here today. And just continuing our conversation of sanitization, we have a toilet warrior, Mark, with us here today. You've been visiting India, Mark, for a while now, and you've done some amazing work and you have some great projects underway. Please tell us about them. I think I'm a toilet warrior too. I'm a climate warrior definitely, but I'm a toilet warrior too. So please tell us about all the amazing work that you're doing.
Namaskar, Dostan. It's so nice to see you all. And Bhumi, I'm a big fan of your movie, The Toilet Ek Prem Kata. It's one of my favorite stories, such a great story. And Amitabh, I'm a little bit starstruck talking to you here, but I'll manage. So I started coming to India on business about 10 years ago. And about 8 years ago, I was on a train in Mumbai, and a couple of young men approached me, and we started chatting, and they invited me to visit their community. They lived in Dharavi, so the biggest slum in Asia. And I was a bit nervous, but I thought, you know what, I'm going to have a look. Nice guys, I'm going to have a look. And they took me to a school in Dharavi, and the first thing I noticed were there were no teenage girls in the school. They had all dropped out because there were no toilets in the school. Yes. And this is probably about 8 years ago. India has come so far in that time, particularly through the Swachh Bharat program, but also through the kind of work that I'm doing with Rotary and others. So we started out with an idea, let's put 15 toilets into a school near Nasik. The school had 500 kids. And so working with the Rotary Club of Nasik Road, I'm sure they're all watching now and very pleased I mentioned their wonderful club, we put 15 toilets in and changed the lives of these 500 kids. And this thing started to grow, and that's like 5 years ago. In the 5 years since, we've now reached 100,000 kids plus in Nasik, in Pune, in Delhi, with our great friends at the Rotary Club of Delhi, Ashoka, who've done incredible work up there. And then we work with World Vision, we work with of course the guys who are behind this whole thing today, the Dettol people who are really helping save lives in a big way. Our programs are, firstly, infrastructure, the easy bit, build a toilet. You give me a shovel and some bricks, I can build you a toilet. But then there's the hard bit, the education programs, the software, if you like. So the most important part of our project is teaching people the necessary behavior changes to help them improve their future opportunities, and particularly starting with kids. When kids see something that makes sense and it's taught to them by someone they trust, not only do they adapt their own behaviors quite quickly, because kids absorb new information so well, but then they take it home to mum and dad and to the community. And we've seen as I said, direct impact on 100,000 kids, but I know for sure we've actually impacted on 500,000 lives. And this is out of a little Rotary Club here in Melbourne, which I became a member of after discovering this issue of lack of toilets in schools in India, and of course in the broader community. And our timing was wonderful because it wasn't long after that the Swachh Bharat program started. And so there was this huge social will for this change in India, and we were able to ride that wave with our friends at the Rotary clubs in Nasik and Delhi and Pune as well. So.
Thank you so much, Mark. In fact, I completely agree with you. Just the lack of toilets can actually harm the future generations in a bigger way, education being the biggest. And as you said, there are many girls that drop out of school, especially when they are closer to getting their period, because there is, we don't really, because of the lack of toilets, and I've obviously done a film about it. And so, you know, there was so much that I came across while filming Toilet Ek Prem Katha, which we will talk about. But thank you so much, Mark. We also have Jack joining us. And Jack, you've been working for over 23 years on toilets across the globe. From your experience, please tell us, how can cleanliness solve the problem of health and economic crisis of a country?
Yeah, thank you. So basically, I founded the World Toilet Organization 20 years ago. This year is our 20th anniversary. And at that time, people were very shy to talk about toilets. And yet we have to go to the toilet 6 to 8 times a day. So sanitation, hygiene, today has become the highest awareness in the history of mankind. Every single person is worried about COVID, so they are washing their hands, they're keeping their distance, they're wearing their mask, and they are very clean. We need to keep this habit and use this to leverage on the behavioral change. In the Swachh Bharat, we have created so many toilets, but now we have to promote that people will clean them, people will maintain them and use them for their own safety.
Joining me on this panel is Ravi Bhatnagar, Director External Affairs and Partnerships, RB. Pinaki Ranjan Mishra, he's from EY, he's a consumer leader, Ernst & Young. And we have Ramona El Hamzoui, she's the Acting Mission Director, USAID India. Thank you all for joining us. Ravi, first of all, I would come here, I would like to ask you, tell us about the hygiene index. In fact, even the hygiene bond, it's just been over a year when you all have launched it. Just tell us about it, please.
Thank you so much. It's a great privilege to come back on the show, and this is a very, very special day. And on the same day last year, we made our commitment to launch the Dettol Hygiene Impact Bond. And I'm very proud to say, we have averted more than 7,000 deaths arising out of diarrhea in the period of 1 year. And there were more than around 11,000 plus kids who were seriously critical. So we made them reach to the private and the public healthcare facilities. So to us, the bond is working perfectly fine. And there is a lot of demand coming from the public health practitioners in the state of Uttar Pradesh to take it to all the districts in Uttar Pradesh, as well as when we shared it with others in Bihar and other places which are, epicenter of diarrhea. Yeah. So a lot of excitement is there on that. The big difference is the financing mechanism. So it's not like you're writing a check to someone and saying we are paying you this money for doing this charity work. First you bring the results and then we pay you. So it's a result-based framework which we have started. Although a lot of people say in India something like this doesn't work, philanthropy is different, but we are seeing the quick successes of this work. And on the top of that, the first question what you mentioned was on the hygiene index. Yeah. So we started the hygiene index work when the Chris Martin and many others were there in Mumbai during the Global Citizen launch, and we took it to 25 cities in India, and we partnered with the government of India in various states, and now it is Swachh Sarvekshan, where we see Indore is topping again and again, and Varanasi has also come in the top 10 cities under the Swachh Sarvekshan. It's a very good feeling cities are experiencing progress, But there's a long way to go for everyone. And, you know, at the end of this, like, you know, what we are also observing is, like with this corona coming, lives have changed. Some people are saying this is the new normal, but I don't know it's new normal or what. I must say, like, the efforts must multiply. What were getting put by, you know, various people like the doctors, nurses, paramedics, as well as the sanitation workers. Because if I tell you, like, most at risk is sanitation workers also. Because as the population is increasing who is COVID affected and infected. So we are seeing, like, you know, they have a lot of masks are getting used, the PPEs are getting used, the sewage distribution system is very different in India. So we need to do something for them. So that's one thing. So hygiene, teaching them the basic hygiene so that they take care of themselves at this moment is super critical. Otherwise, day is not far when many of them will also get, you know, infected because of someone. So why one should be responsible for that? So we need to think about it.
Okay. Pinaki Ranjan Mishra, EY India Consumer Leader, Ernst & Young is also with us. Pinaki, we believe EY has been playing a role in hygiene in India. Can you let us know how?
I think, you know, as Ravi mentioned, we have been partnering with NDTV and RB on this program for the last couple of years. We have been instrumental in actually creating the hygiene impact, the whole measurement systems, and then tracking the 25 cities that Ravi mentioned.
Yeah, okay.
And it has been a very interesting journey. I think this whole hygiene index helped bring to the fore of what we should be doing. It also helped a kind of a competition, as I've told in the earlier meetings, is that it helped cities to compete with each other, to look at best practices, to learn from each other, and there has been a substantial improvement over the years. So, and I think our role primarily has been to craft the program, monitor the program, and also give the kind of measurement and statistics and advice to these cities so that they could improve over a period of time. And we have had very active participation from the other stakeholders who were along with us in the whole journey, apart from, of course, RB.
Yeah, I'd like to ask Ms. Ramona a question. Ma'am, what is USAID's strategy on health and water sanitation and hygiene, which is in abbreviation WASH? And how is USAID partnering with Reckitt Bengt on nutrition, hygiene and sexual well-being, working with RB?
Thank you very much. A few points to add to that question, and thank you for asking that, and really happy to be here today on the panel. So USAID and the government of India, we share a development partnership which spans more than 70 years. And today this partnership really looks at ensuring that the gains that we are reaching together in development are felt amongst the people across all communities. So the focus on inclusive development. And we've adjusted our partnership to better recognize India's leadership as a major donor in its own right. So when you look at our strategy and our approach, we work really closely with the government's initiatives, very bold initiatives to improve the lives and health of people, such as has already been mentioned, the Swachh Bharat initiative, the Ayushman Bharat initiative, the health insurance plan to provide healthcare for nearly 500 million people. And so we look, again, our strategy is we look at the government commitment and the growing and active engagement of the private sector. And we work with a unique partner-to-partner model to address this. So we work with the government and a range of private sector actors. And our focus together, which is really important, is to identify, pilot, and scale up these cost-effective solutions and best practices for India's development in this sector and across all sectors. And we think this integrated approach with private sector engagement and sustainable financing, which is something I'll talk about in just a minute also, as Ravi had mentioned. It includes really strong practices in procurement, and in the WASH sector, we look to enhance the impact of our own investment and commitment with all of the partners so that we can increase access to services in India's urban WASH sector. So when you look at the partnership that we have with RB, we're really pleased about this. And we're, again, We're results driven, as I think you all are as well. So we developed the first health development impact bond in Rajasthan to improve maternal and child health death rates. So unlike traditional development funding, with a development impact bond, payments are made only if measurable and verifiable outcomes are achieved. And it's innovative, sustainable, it's a market-based financing mechanism, and it takes a business approach. So together with RB and state governments of Madhya Pradesh and Uttar Pradesh, we're using this development impact bond model to improve nutrition status of 30,000 TB patients and avert 700,000 diarrheal deaths. So two areas where our work aligns really well with both RB and the state government's interests. So I'll end there, but we've got a long partnership with RB.
Wishing you all the best, Ramona, for that partnership. Thank you, Ramona, Pinaki and Ravi for joining us.
You need to localize and keep in mind the context that is really there. If you're making a film in a particular village or for a particular community, it should ideally be in maybe their folk language, or maybe get in some folk music along with that, or maybe get in some Bollywood music where they're able to connect with that. It's important to get in the opinion makers. The Prime Minister, for instance, his Janta curfew, his communication regularly with people, that's all towards instilling behavior change. Now, behavior change standalone has the risk of not becoming part of your system if it's not backed by sustainable practices. That is very important to make it sustainable. So you will need to eventually back some of these behavior, what is directed as behavior change, you will need to back that with some changes in legislation. For instance, now wearing masks has become mandatory. Gatherings of particular places are there. You will need to also look at getting it into the school curriculum, because at the end of the day, children are the best change agents. They are not only the ones who are going to be your future generation, but they are the ones who will go back to their home and come back and influence others around them. And then, of course, you will continuously need to look at training, look at how you're going to be making it embedded within the system. So I would say really that to get in behavior change, you need to look at what I would say a CARE framework, where C stands for calibrated change, a slow step-by-step change. A, it should be anchored and be practical, anchored in practicality. R is if we need to be reinforcing it and repeating what we really want them to do. And finally, it should be economical and something that we can easily do. So these are some of the steps that are required. It's not something that happens overnight. It's not something that one person can really do. All these things that I've mentioned, they need to converge finally, and all these have to be done simultaneously to be able to do that. There are so many good examples. I mean, when you speak about in the COVID situation, when you talk about people needing to wash their hands for 20 seconds. Right. In UK, they came up with a very small thing that sing happy birthday to you. That's a 20-second thing. So people that have actually started, children have actually started singing happy birthday to you, and that takes 20 seconds. And that's really made sure that they wash their hands for 20 seconds. Yeah. So there are a number of such things. Or marking these zones for, when you talk about safe distancing, you go to the shops, you mark these zones. These are all small proddings that are done to make things happen. People used to be spitting on walls. Suddenly you find in a number of government offices and public places, you've actually got goddesses and gods there, their sketches or drawings there to stop that.
That's a nice way to define a nudge. Now, you know, Rajesh, you and your London Business School colleagues have been working with entrepreneurs in rural India over the last several years. How are you staying in touch with the villagers now? What are some of the challenges that you've witnessed?
That's a great question. Actually, this was a dilemma we had when the pandemic hit. Normally, at this time of year, I would be in rural India, out with the villagers rather than in a suit sitting here in London. And when the pandemic hit, of course, we needed to understand, given all of the different research projects and teaching programs that we have, we needed to understand what is happening. More importantly, get a sense for how villagers in rural India are responding to this pandemic. And what has been striking is how the investments that were made much before the pandemic, and sometimes just months or a few years before the pandemic, are now paying off. So now we're able to communicate with villagers on their phones, even if they don't have a smartphone themselves, a member of the family has it. And it's remarkable. We've been able to to create these village level roundtables involving villagers on Microsoft Teams or Skype or one of these programs. It's remarkable. And to be able to hear the voices of the villagers in an unfiltered, direct way has been striking. And so we've been able to get government officials, NGO leaders, corporations together with villagers in a manner, strangely enough, that would have been hard to envision back in the pre-pandemic day. Perhaps will be a permanent legacy of all of the awful things that have been happening now.
Ashwajit ji, just like to ask you something. You know, what should governments do to nudge health and hygiene actions? And do you think you could tell us anything about any examples of nudges that you have worked in, you know, changing behaviors and norms? We heard a lot of what you had already spoken about, but from the side of the government, you know, is there anything that the government can do?
Yes, of course. I mean, to start with, the government needs to make this, get this mainstream into the school curriculum, because we are clear, you said earlier in your program today as well, that we know that the vaccine is not something around the corner. We also know that it's going to take years by the time it's going to be distributed widely, and then who knows, there's going to be a next pandemic coming in. So it's important for the government to inculcate and start this in the school curriculum. Important for the government to continue with its policies around masks and gatherings and social distancing. It's important for the government to continuously come out with research reports on the risks of what would happen if you don't do what you're doing right now, as well as positive news as well. It's important to get some positive news. It's good to see you, for instance, being here after having gone through this particular thing. It's also important for the government to recognize some of the best practices, come up with awards, recognitions, etc. And at the end of the day, it is extremely important for the government to also monitor what is happening. There's no point in making policies which are poorly implemented. It's more important to make, even if it's a mediocre policy well implemented, that's far better than making a great policy that's poorly implemented. There are a number of good examples of what governments have been doing around the world in various areas. Now, take the example of Spain, for instance. There they have a default option for organ donation. If you don't want to give your organ, you have to say, I don't want to give your organ. And as a result, Spain is today one of the leading countries as far as organ donation is really concerned. Similarly, in the UK, you've got an automatic pension plan. If you do not say, I don't want to get into a pension plan, people get into a pension plan. Or for that matter, in shops or in malls, if you start putting sanitizers and hygiene and masks at the cash counter, replace that with chocolates and candy bars and things, that itself will automatically do that. And above all, of course, the government would also need to continuously provide facilities, because there's no point going and telling villagers to wash their hands if there's no water. There's no point to tell them to sanitize if that's not available. So I think it's government has a huge role to play in this entire thing to make it sustainable and long lasting.
Yeah, Rajesh, women, play a huge role in behavioral change. So how are they driving behavior change in health and hygiene? How can technology help them drive change during this pandemic period and lockdown?
That's a great question, Mr. Bachchan. As you know, women in India have always had a role in driving change. Often that role has been behind the scenes. What you're observing now is women up front. And especially in rural India, once again, because of the kinds of activities that you and other panelists had described, for example, the toilet building campaign, very often the leaders behind these on the ground were women. And because they were involved in these very visible and generally positive, perceived as positive activities, now when women organize WhatsApp groups and communicate information about what's happening, try to overcome misinformation, or organize the kinds of nudge activities that Ashwajit ji was referring to. So organize village level poetry competitions around hygiene, organize ways to understand how information, where to get information, for example. When they do this, their role becomes even more prominent. So on the one hand, women have had a role often behind the scenes. More recently, they've had a much more visible role, and that is changing. Now with the pandemic, especially since people are not able to travel as freely, women, especially women entrepreneurs who've had the training or who've had the ability to do so, are organizing in activities we're working on, for example, with an organization in India called Dharma Life. They're organizing these large WhatsApp groups and discussions, and in the process changing things, changing behaviors. For example, on female hygiene. For example, around indoor air pollution, for example, around, of course, all of the COVID-related health activities. And so everything we've just been discussing has been coming together through the focal point of the female leader.
Yeah, very encouraging to hear that.
Yeah, it's interesting how, behavior nudges. Thank you so much, Mr. Chandy and Mr. Singh, for joining us.